Welcome to the channel, and today we're going to discuss cavernous hemangioma of the conjunctiva, which is a pretty rare lesion which you see over here. Here you can see these are big spaces, and the big space is called a cavern, or if there's a big space which has an inlet of blood vessels and an outlet, that's called a cavernous space. And what happens is, because it's an outpocketing of the venous space, it's a low space setting in which the fluid tends to reside over here. But if it was a high flow thing, then it would be an arteriovenous malformation over here. But here, because it's giving that lobulated appearance, this is a cavernous hemangioma of the conjunctiva, which you see over in this patient. Let's see what it looks like on slit lamp examination, and we were able to sort of see this on a higher magnification. And if you have a red-free filter, if you put that on, you can actually see blood vessels flowing in the capillaries, and this is an elevated lesion, and you can see it's giving sort of a lobulated appearance, and it was just trying to see if it sort of trying to see with the red free filter over here. And the good thing is we were able to blanch that with argon laser, and it responded pretty well with that. And this is what you see with a red free filter. You can see the blood over here, and the blackish areas where there's more stasis of blood, which you see in these patients. So red free filter is a useful filter to highlight these lesions over here in these patients. So let's see what is the differential diagnosis of these patients. It can be a capillary hemangioma, which you see over here in this patient. This is a capillary hemangioma, and this does not have that lobulated appearance. It's not having that strawberry shaped appearance as you would see in a lid hemangioma. And this is a cavernous or a lymphangioma over here, where the lymphatics are involved, and it will be more transparent, and it's sort of if you just tend to push it, it will disappear, and as soon as you give an incision to it, it just disappears completely in that sense. And then, as I discussed, arteriovenous malformation is something which becomes bigger in size, and that would increase on Valsalva maneuver as well. So these are the different hemangiomas of the conjunctiva which are commonly seen, and we described a cavernous hemangioma for you today. Thank you very much for watching, and please do subscribe to the channel.